Hi everyone, it's Rowan here again with Sandstone Care. Thanks for watching. And today I'm here with Melissa Barbash. Melissa, can you tell us a little bit about yourself and what you do?
Sure. So, thank you, Rowan.
Absolutely.
So I'm Melissa Barbash. My practice is called Recover Me Counseling. I'm a private practitioner here in Denver. So I'm a clinician, and I have a practice that focuses on addiction recovery and also codependency. So for family members, spouses. I also focus on groups for people that are struggling with both of those as well as an additional support for if somebody needs an additional support to the 12-step recovery or to smart recovery. A lot of people could benefit from individual or group support.
Yeah.
So that's my practice here.
Okay, thank you.
Yeah.
Yeah, much needed. I think because as we talked about a little bit before, there are processes like Al-Anon for people to get support in how to support their loved ones, and often that doesn't land for a lot of people because there's not enough engagement and processing of their experience, and so thank you so much for providing that for people. And I want to talk a little bit about this word codependency, because I feel like I've heard it a lot, and people quickly get labeled as codependent for as little as just wanting to do things together on a repeated basis. And so can you unpack that a little for us? What is codependency and how do you work with that?
Yeah, so I have a great appreciation for how codependency was founded and the books that surround it and how those help people. And I even promote those books for people and say, please go read this, just kind of understand a little bit about how you're interacting with your partner. So I think they're very beneficial. I think sometimes what tends to happen is that people can get upset about that label as well, because it can feel very limiting, and it can feel very much like there's no way out of that. So you're always going to be that way, or you're always going to be that way.
Right.
So I think that's what's tough for people sometimes. But for me, the way that I talk with clients about codependency is if the other person's life has become more important than your own, that's your entire focus. And then your emotions kind of mirror theirs. So when they're having a good day, you're having a good day. When they're not, you're completely anxious, or you're feeling something that they're feeling. So it's really hard to kind of keep yourself, just keep your own identity within that.
Right.
And then a lot of the clients that I work with experience a lot of anger toward their partners too. So there's a lot of caregiving, but there's also a lot of resentment that goes into that. And so that usually encapsulates a lot of the people that I work with and what I see in people who struggle with the kind of term codependency as well.
Okay, thank you. Yeah, that's really helpful. So what would you do? I mean, this is a really hard question. Obviously, it really depends. But when you have someone who is struggling with that being in a codependent relationship, what are some of the things that you can do to start to address that and work with that?
So one of the things that I do want to say is that I do encourage people who come out of family programs or who are just in the community kind of wondering whether or not their spouse is drinking too much or using too much. I do encourage them to kind of take a look at Al-Anon as an additional support. But if
I was kind of bashing it a lot. I didn't
intend
for it to come across like that. I actually appreciate it a lot.
But it just doesn't work for some people too. So I encourage people to kind of take a look at it and use it for what they need, and if they don't need, then they don't. But I also want to align with treatment programs that kind of encourage that. So I want to support that, but also be another resource for them at the same time. So within the context of those meetings, there's support. There are certain ways that you communicate, but in therapy, I actually encourage people to talk about their spouse or their partner for the first several sessions, because they can tend to feel so, they tend to do a lot of secret keeping. And so, and their life has also become about talking about the other person as well. Right. And so if I go into the session going, you cannot talk about this person anymore.
Kind of alienating them already.
Yeah, and it's tough. They don't know how not to also. And so, I was a spouse, or a partner. I was not married, but I was a partner, and that's all I could talk about. Yeah. And I needed someone to let me talk about it, but then also to help me not do that anymore. Right. So that's what I see in clients, is that they need that space, but then you kind of help them shift into talking about themselves and how they're impacted. But it's a tough adjustment for people.
So it sounds like a big part of it is kind of meeting them where they're at, and then kind of trying to slowly shift that towards to where they can start to identify how they can.
Yeah, and by calling it by its name too, which is your whole life has become about this person, and kind of noticing that that's what's happening too. Right. Because they know that. Yeah. But they just can't, it's just too hard to separate like immediately. So therapy can really help with that, where someone can feel like it's okay for them to talk about their partner, but they can also start really talking about how upset and angry and anxious and unsupported they feel, and there's an education too that I can provide. Having worked with people who do struggle with substance abuse, I can also provide an education for people in the room.
And what that's like, what they might be going through.
Yeah.
Okay.
Yeah.
And you do both, right? Just to clarify.
Mm-hmm.
And do you ever work with a couple where you've got both people separately, or is that generally you're either working with the partner or with the person who is struggling with substance abuse?
Yes. So I'm not a trained couples therapist, so I don't do couples therapy. But if I've been working with someone who went to treatment for alcohol and is in recovery, and they want to bring their partner in just for a session, we can do that. Just to bring the partner in to kind of get an understanding of what this person's working on, but it's not a couples session. So I'll usually refer the couple to somebody else. But I can work with each type of individual, just not a couple separately. Yeah, that's unethical.
That makes sense. Well, and it seems like just for getting a perspective of like, okay, now I've heard about this person, now I get to meet this person briefly. I'm not going to engage with them as their primary therapist, but I'm going to have a perspective so that when I work with my identified client, I can be like, okay, like I met this person, I know what you're talking about, I know who you're talking about.
And a really good opportunity, so if I'm working with a partner and they want to bring their spouse, in who's struggling with addiction, it's merely as a support system. I would say bring that person in so they can hear about what you're working on, and maybe some of the things that you're, not saying outside of here you can tell them, but I'm not going to focus on that person. It's kind of going to be an observational kind of setting. Okay. Yeah.
Cool. And what about for the groups? Tell me a little bit about what that looks like.
Okay. Yeah. So I love group.
Okay.
It's one of my favorite things to do. Okay. I've seen it energize people. I've seen it do things that individual therapy just can't in that amount of time. Okay. So there are some great support groups out there right now. So there's the Al-Anon AA. There's some great there's Smart Recovery. There's LifeRing. There's kind of all sorts of programs out there to help support people. But Process Group is its own kind of animal. So Process Group, I work with people with addiction and codependency, kind of intermixed in the same room. Okay. And we talk about what's going on. So someone will present an issue about, how they're struggling with their addiction. Okay. But the group is really about how people relate to one another. Right. So they relate on the topic, but, people get kind of stuck in addiction, and people get stuck in relationships because they have difficulty interacting with people, or they don't know how to receive feedback necessarily, or give feedback, or they're afraid to, feel like they're wounding somebody or hurting someone's feelings. So it's all done in the dynamic of the group. And there just aren't a lot of those types of groups out there, specifically for addiction and codependency.
Okay.
So I that's my baby, I guess.
Okay.
I love it.
Cool. Yeah. And so when you're talking about someone who's codependent, is that generally something that follows them around until they address it? You know, if I'm in a codependent relationship and then I break up, am I likely to go into another codependent relationship, or is that something that really is kind of specific to that relationship in general?
So, you can definitely go from a relationship to relationship, and have this codependency to you.
Okay.
And it can show up in different ways. So, typically what I see is somebody has the same, they're the same person in the different relationships,
right.
but they end up getting in relationships where someone is struggling with alcohol, or then the next person, doesn't talk about their emotions at all, or is
right.
shut down.
Right.
The next person is also another person that's been in relationships with, or like their parents were alcoholics.
Okay.
So it doesn't really matter person to person what the spouses or what the partner's
right.
propensity is. But if I was saying me as an example, I would probably act the same way in those relationships, because I wouldn't know how to not help somebody and not make them about, not make everything about them.
Right.
So it probably would follow me around, those feelings, that resentment, that anger, that fixing propensity.
Mm-hmm.
So it just kind of starts to slowly and then more quickly strip away who you are. So the people that I find that I work with the most are the ones that are saying, I don't know, I don't know anything about myself. I lost my voice. I lost completely who I am to alcohol or drugs or to these relationships. So that definitely happens.
And I actually just did another podcast about that whole process of kind of discovering who you are in recovery or whatever it is, and I'm sure it could apply just as well to relationships, and that process of discovery and of finding a purpose of who you are. And in that process, I imagine that someone would also be able to be much more authentic in their relationships. They feel like they're coming from a sense of who they are. Yeah,
they don't have to be as fearful about being who they are in the relationship. Right. I don't know if this is okay, but I named the practice Recover Me.
Okay.
Like kind of as a play on words on recovery, but also like the idea is basically to recover yourself from what you've been doing.
Right.
So from what's been getting in the way. So exactly what you're talking about.
Cool.
Yeah.
Well, thanks so much. I really appreciate learning about this, and I think it's such an interesting piece, and so much of what we focus on here at Sandstone too is those relationships. That nothing is happening in a vacuum, and so for people to be able to learn about how the way that they show up in relationship might contribute to or take away from their sense of self is really important. So thank you so much for what you do. And how would people get in touch with you?
Yes, and
they wanted to work with you.
Also, I really believe in what Sandstone does as well.
Yeah.
So I'm happy to be here because I like all of the program that you do. I like the way that you invite family members into the process, and that's like an immediate part of the process. Based on what I do, I think that's very important.
Yeah.
So I'm happy to be here to support you as well.
Thank you. Yeah.
So how do people get in contact with me? Well, I have a website, so it's just, I hate saying www, recovermecounseling.com, and then my contact information is on there. Do you want me to give my phone number?
I'll just throw it.
Okay.
I'll just throw it below the video so that everyone can get in touch with Melissa.
Okay.
Melissa, thank you so much for coming on, and thanks for watching.
Thank you.